Good afternoon, everyone, and welcome to the Ho-Chunk Nation Department of Health Public Health Virtual Education Series, WAZOOKI WOOEHI, Family Conversations. My name is Jamie. I'm a Public Health Worker Supervisor, and I'm here today with Renelle, the Public Health Nurse, and we are your hosts. Our Department of Health is guided by the vision of building a strong mind, body, and spirit together. Through this virtual education series, we hope to bring our communities together by sharing knowledge, strengthening connections, and encouraging conversations that support lifelong wellness. In public health, our commitment is to promote, prevent, and protect. Each month, we partner with knowledgeable presenters to explore topics that support healthier individuals, stronger families, and thriving communities while highlighting Ho-Chunk culture, resources, and services available for our communities. We are pleased today to welcome Rachel Dozer from Behavioral Health. She's located at the House of Wellness, who will be sharing her knowledge and expertise. Her presentation today is titled Empowered and Informed, Substance Safety and Overdose Prevention. Rachel will have about 45 minutes for her presentation, followed by a short Q&A. Please use the chat to submit any questions or comments that you have throughout the presentation. Renelle and I will monitor the chat and share your questions with the presenter during Q&A. If you prefer, you can come off mute and ask the questions yourself. If we're unable to get to every question today, we will forward them to the presenter and provide responses following the session. As always, today's presentation is being recorded and will be available on the Department of Health website and Facebook page. Everyone, please welcome Rachel.
Hi, thanks for having me back. I was really excited to share what I can about this really important topic. As per usual, when it comes to mental health stuff, I feel like 45 minutes is never enough, but I will do my best. And if there are any questions afterwards, please don't hesitate to ask. For the purposes of this training, the only substances I've really focused on are the ones that I feel like are probably the most prevalent in our communities, and that would be alcohol and opiate. There is a little bit of information that'll be shared with regards to THC concerns, but if you had any questions about a specific substance use outside of the ones that are mentioned in this presentation, don't hesitate to reach out and ask, and I will do my best to connect you with the right information. So next. So a quick overview of kind of our agenda. Is there anything, kind of just what I just said, is there anything specific you're hoping to learn about for those that are joining us today? My personal presentation style is I like to personalize the information I'm sharing. And it's kind of hard to do so when we come from such broad areas around the state. Okay, so we're going to touch base quickly on a little bit on what is substance safety, and then how to have meaningful conversations around overdose prevention. And I think that communication piece is really important. I don't know for those in attendance who have ever been to an assist training that was hosted by the nation for quite a few years. I was one of the assist trainers, and so one of the things I would teach people in that training, so assist is applied suicide intervention skills training, is that the way we handle whether it's a suicide crisis or really any crisis in general can be kind of done in a similar manner. So the information that I'm sharing with you today, when it comes to having those meaningful conversations around prevention in case we're trying to minimize a crisis from occurring, can be done on a number of different topics. Same tools, different opportunities. Also included are some really awesome community resources. There are links in the presentation. If you would like to have the presentation yourself, I'm more than happy to email it to anybody. That you can use those, you can follow those links for additional information. And one of them will definitely, like, hallmark a little bit today. I'd like to, if it doesn't mess up the flow, see if we can actually take you to that website, if possible. Okay. So anything specific people are hoping to learn a little bit more about? I know I keep asking that, but I feel like leaving a presentation is, with questions is kind of like leaving a meal hungry. Try to reduce it as much as possible. Okay. So what is substance safety? To me, I guess I would take this in the same line of thought as how we would approach gun safety. How we would approach educating our community members about, safe sex practices. Substance safety, I think it looks a little bit different in every home. I think it depends on what is a priority in that home. So for instance, we talk about a lot of times in Wisconsin, alcohol and now slowly THC are kind of considered like, recreational substances. But there is a heavy correlation between alcohol use and THC use prior to engaging in more harmful substances with a higher fatality correlation, like fentanyl, heroin, methamphetamine, pills, just in general. I haven't heard a whole lot about pills, prescription meds being abused. As I know it still happens, but I remember when I first started in this field about 12 years ago, 13 years ago, there was a concern what they would call like farming parties, where you would just go to a house and dump all the pharmaceuticals in a bowl and just grab a handful of pills, and it was kind of Russian roulette what happened. I don't hear about as much of that happening anymore, but regardless, there is definitely a strong correlation between alcohol use and THC use co-occurring with those other substances. So kind of just being like aware of that, if that's something that is kind of like normalized in your home or in your your community space. And when I say community, like I said, we're all over the state, right? Having that conversation with the young people around you or with your close system of what to do if they've had too much of either, or what to do if they don't want to participate, but it's being encouraged. I think Jamie, actually, I think you're the one who introduced me to this one idea that I thought was brilliant. And one of it was, this kind of falls under the making a safe use plan as a family and a safe absence plan as a family. So for the safe absence plan, is teaching our young people to have like a code phrase that they could, text their parent or their guardian. So like, for instance, like if my daughter was at a party and they're offering alcohol or THC or drugs and she didn't want to participate, she could, just, text me quick, like, can you call me? And if I call her, I'm gonna call her sounding really mad, and then she'll have an out, right? So for a lot of our teenagers, they don't want, to experience the social consequences of having, a life of abstinence if their peers don't agree with that. So, she'd call me and be like, home, or text me home, and I'd call her like, what are you doing? You're supposed to be home at this time. I can't believe you, young lady. How dare you stay up this late? And then she'll like, oh my gosh, my mom's making me come home. I'm so sorry, guys. And then I could pick her up. It's kind of, another option. Or if, if the idea is, okay, if you're going to, so, we've had this with my, of age relatives. Well, if you're going to be out someplace and you're drinking, call me if you need a ride. I don't care what time it is. Call me if you need a ride. I don't want you to risk being behind the wheel or being in with somebody else who's under the influence. Having those safe conversations. I think a lot of times with families, or what I'll hear a lot in session, if I'm being honest, is I'll hear people say, both young people and our adults, well, they should know. They should know they can call me. Well, no, not really. A lot of our young people are afraid to be a burden to the adults around them. So they don't always know unless we have that conversation. As far as medications, I meant to find this out before our presentation and I didn't get a chance to, but the last time we had a behavioral health meeting, I think we still offer free med boxes through pharmacy. So if anyone has prescription meds at home that they would like to keep locked up to ensure they don't get into the wrong hands, the pharmacy does have that, to my understanding. And also with that too, especially with our elders. Okay, thank you. Someone said that in Black Widows. I think they do here at the House of Wellness too. I'm like pretty sure we just had this conversation a month ago, and they said that Amber Hannah is our kind of liaison here at the House of Wellness, and she said that we had some here. It's also just having that conversation about what prescription drug safety looks like, and that being, and this is a conversation honestly to have with our elders, if I'm being completely, transparent. Where they'll have, someone will, oh man, I hurt my knee, and God is like, oh, I got something from my back surgery. So just like educating families like this, the medication that's prescribed for you is prescribed for you because you were the one who was seen by the physician. And, so weight matters. There's so many factors that come into somebody receiving the prescription that they received, that just giving medication to other people is very dangerous. So that would be something to have. I mean, I had to have this conversation with my own grandmother a couple times. I tried giving, your brother, and I was like, don't do that. Don't. Your doctor gave you what they gave you. Or we'll hear families say, well, I have this leftover, these leftover pain meds from my hysterectomy. I'm just going to hold on to them in case I need them in the future. No, please don't. Medications don't last forever either. So to ensure safety, right, we want, you use your medication for its intended purpose, and the ones we don't use, that's why we have, prescription pickups. The police department, you can always drop off medications at the police department. They might not always be happy to pick them up. I'm laughing because I have a story where I had somebody bring like a bag full of pills into the clinic I used to work at before came back to Ho Chi Minh, and I just called the police, and they were like, really? Like, yep, come pick them up. And they came pick them up. So really just kind of looking at what works, what makes the most sense for you and your family. But if I had to summarize it in a nutshell, when it comes to substance safety, don't assume anyone knows anything you assume they know. Sit down as a family and make a decision. What does this mean to us as a family? And I think for those on here that have kids, even if they're just, the super Dega, super chewies, what about disposable meds that are over the counter? I think those are probably a bit safer. If you have like leftover like Tylenol, you can probably just throw those away. I don't know. I mean, you just surrender them too if you want. But don't flush them. I know that one for sure. I don't think there's as much. I don't think that one I would worry as much about as I would more the prescription medications. But yeah, just sitting down as a family and being open and direct with expectations and concerns. I hear a lot of times families will say, well, my kid knows better, my kid would never. Sure. But what if? What if they were put in a situation that, compromised their values, right? Or I think it just, to me, what I've seen too with families, the more we can be open and direct about everything, then it lets our young people feel a little bit more safe to come to us about anything. So we can't really assume that, people know what to expect. To answer that over the counter questions, yeah, as far as dieting, supplements, like, if you have for me personally. I mean, I've had different like vitamins I wasn't using anymore. I just kind of threw those away. I think that was fine. What we're really concerned about is more the substances that can be abused, right? I mean, have there been situations where kids have, or individual, I shouldn't say just kids, but individuals have tried to overdose on Tylenol? Sure, of course. But it's just not as likely, it's not as common, and the our concern for like fatality isn't as high. It takes quite a bit of Tylenol to do that, versus like it can only take 1 or 2 prescription medications. Okay. So here's just some quick information regarding specific to alcohol poisoning. Just some things to consider. A lot of times people, like, I guess my biggest concern with alcohol is, I think just being in Wisconsin, we kind of have this culture where somebody might be experiencing alcohol poisoning and we just laugh it off as like, oh, they can't handle their liquor. And alcohol is tricky. Like that one, whether it's the alcohol poison itself or also when it comes to people who are in active use of it or actively addicted to alcohol. I hear a lot of people, oh, I'll just go cold turkey at home. No. So the two we've always, learned, in the behavioral health side of things is when it comes to alcohol or like benzos, right? Alcohol, those needs to be medically treated. So monitoring people seem like confused or like slow responses, lack of coordination, right? There's a lot of things that like people kind of correlate with like, oh, they just had one too many. But it might be more serious than that. Thank you, Renelle. The other thing too is when we're dealing with, and we'll touch base on this one as again with the opiate use, is if somebody is experiencing alcohol poisoning, they should go to the emergency room. But while you're trying to get them, before you get them help, make sure they're like laying on their side. There's a lot of people a lot of times like just lay down, I'm really dizzy, I'm tired, just need to lay down for a minute. But then they'll vomit, right? Because their stomach's trying to get rid of that alcohol and they aspirate and they choke on it. And then that's a whole another concern. And we're just gonna get to. So here's just a quick little rundown about how alcohol overdoses can be treated, just in case somebody ever asks. Usually the most basic one is IV fluids, right? We're just trying to get them hydrated, get them kind of just more balanced out. If necessary, with oxygen therapy, if their respiratory is being affected too much. Stomach pumping can be really common. And then the dialysis, really hemodialysis, I don't hear that as much, but I definitely, that's why I said, when in doubt, check it out. Just go to the doctor. I think with alcohol, particularly, I hear a lot of people will like, it's fine. I just need to slip it off. It's fine. The cold, clammy skin, bluish skin, like those are the ones that get me like really concerned. But a lot of times, like I said, people kind of just like push it off as, oh, they just need to lay down for a little bit, and then they're not being monitored. So, and anytime this kind of stuff is happening, being monitored by somebody is important. Just, yeah. Renelle, am I missing anything? Me and Renelle always joke. I love helping people with eyebrows up, but when things start to slip to below the eyebrows, I love to reach out to my trusty nurses.
When in doubt, go to the hospital. Call 911 if you have any question.
Yeah, because there's also a lot of times too, people always realize that like there's also like comorbidities. So if somebody already is like pre-diagnosed, like diabetes, they also could be there could be multiple things happening that should not and cannot be treated at home. And a lot of times people don't want to call an ambulance. It's like, oh, we don't want to deal with the medical bill, or We don't want people to see, you know, that there's been a ruckus at our house or whatever. Call the ambulance. They have stuff in their ambulance that can help people get stabilized until they get to the hospital, that we just don't have access to as civilians. My husband is actually EMT, so he's an ambulance coordinator down here in Madison, and so I've learned a lot more about like that kind of stuff since we've been married, and I'm much stronger at just call an ambulance. Like they go through that kind of information to see what might be needed before they come out to do the visit. Okay. Signs of an opioid overdose. So this one we have a little bit more information on. Here's just the basic signs to kind of look for. The thing that's really, one of the things we've been trying to tell people is, if in doubt, use Narcan. Even if, like, you know, you ask them, you know, you're noticing that maybe you can't tell if their pupils are getting small, right? For a lot of our community members, I have, you know, myself on Twitter, I have really dark eyes, so it's hard to see my pupils, period. If you're just not sure, just use some Narcan. Narcan's kind of our go-to. Still call 911. Still call 911, but even if it's not an opioid related overdose, the Narcan's not going to hurt anything. If it is opioid related, we want to get that Narcan in them as fast as possible. So here's just kind of some of the basic steps. A little bit of side information. One of the things, I think I touched base on it in a minute, but doesn't hurt to say it now again. I was talking to Renelle and Jamie before this presentation, and they reminded me, which I thought was wonderful, and I just want to share it. When you're seeing these different handouts and you're seeing people say, like, you know, okay, call 911. Okay, well, I can call 911. I got that. But how the heck am I supposed to? I don't know anything about Narcan. What do I do with it? Just shove it in their nose and push it down? I mean, essentially, yes. But like, we have like on our staff for behavioral health, we have Nicole Cotto, Manissa Paulus is gonna be out on maternity leave soon, but they're both Narcan trainers. Like they'll come and do Narcan, like trainings on how to administer Narcan. When I was preparing for this presentation, I was surprised how many like online opportunities there are. Free like online opportunities. I know you can just go to Walgreens, like a lot of the pharmacies will show you what to do. It's like a 5-minute training. But for anyone who's like concerned, like I said, the trainings that we occasionally host, and I don't know when the next one is. Like I said, one of our trainers can be on maternity leave soon. That one is a few hours. That way they can like answer all their questions. And then as far as CPR, if you work for Ho Chunk, we regularly provide CPR trainings. It's actually a requirement for most positions. If you don't work for the nation, or you miss one of the nation's sponsored CPR trainings and you would like to be trained in it or refreshed, right? If you don't use it, you lose it. A lot of the tech schools in the areas will do regular trainings and see kind of what's available in your home community. So I know a lot of times we'll talk about these things like, oh, if you need to do CPR, but if you haven't been trained in a while, it can still be a little bit intimidating. So if you're able, like I said, again, this is one of those things, I don't know if the presentation is going to be available for printing, but if anyone would like me to email it to them, I absolutely am happy to. If you want to have any of these handouts available for you. Where we ask about CPR trainings for employees. I would start with your supervisor and see if they plan on hosting any. So interestingly enough, when I was doing the research for that, I was kind of surprised when I saw, you'll see on the next slide, that they are doing mouth to mouth. But I think the idea is when you have, I am not a CPR trainer, so I don't want to like mistake that. A lot of the CPR kits they have right now come with like the mouthpiece. So if you can do mouth to mouth. Otherwise, if you can do mouth to mouth, if they need oxygen, I would do mouth to mouth. When you're talking about like opioid overdoses, the most of it is, I mean, there are people who snorted it. I would use the mouthpiece if you can, at least do chest compressions. This is another reason why it's really important to call 911.
And I think the concern with only doing chest compressions when you suspect that somebody has overdosed is, are they going to puke? I think, don't quote me on that, but I believe that's the concern.
Sure. My only concern would be that the person who's doing the crisis intervention having a contact overdose themselves if they come to contact with the substance. But I think one of our fears is we want people to, let's get this person help. If we're about the puke, the vomit, I would still call 911. And a lot of times they're going to kind of walk you through it too. So that's the thing where, like, a lot of times the first aid kits these days will come with a pair of gloves, the purple gloves, use the purple gloves, use the mouth cover, if you can. They're really cool. Like the CPR kit that they give out these days is this like little tiny pouch, and it's like everything you need is just in the pouch, right? So that would be that'd be ideal. And also too, when you're calling 911, please let them also know that you're concerned that it's a drug overdose. So I've had people before, they're like, well, I don't want them to get in trouble, or I don't want to get in trouble, because then they're gonna like, no. The Good Samaritan laws kind of covers a lot of stuff. We just want people help. We don't want fear of what comes next to stop us from giving people help. And the thing too with Narcan, I would say, and we do cover this in a couple of slides, is honestly the biggest concern with using Narcan is a lot of times people, when they come out of it, like they snap out of it, it can be intense, right? Like it's kind of, they're shocked. And so there have been times that people will like snap out of it and then they get mad, like, why would you do that? What are you doing? I was fine. And it's like, you were not fine. And I always just kind of tell people, like, we'd rather have them mad today than not with us. So, don't let that hesitate. And also, if you can get Narcan, keep a couple boxes with you. Yep, Narcan works for fentanyl overdoses. Keep a couple. So if we're giving out, you'll see like around the nation, I know for behavioral health, we give out quite a bit of Narcan. All of our Narcan kits we give out actually has 2 doses in them. If you or your community wants to have more than 2, please, because depending on longevity of use and like chronicity of use, from what I've been told by different like EMTs, the more somebody has used Narcan in the past, they might need more. It's like the brain kind of starts to like register, like, oh hey, they're trying to take away our fun. We're gonna need more than that. So like if someone needs like 1 Narcan for their first OD, they might need 2 or 3 for their second OD. Right. So it's okay so if you're like, oh, I have a dose, it's okay. If they're giving out free Narcan, just take it. It's fine. We have a lot of grants that we work with to try and keep our community as well supplied as we can. And then one of the resources I definitely want to share with you at some point, they do a really good job, and they'll mail it to you as part of their program. Okay. So here's just a bit more on that recovery position again, right? We want to keep the head supported, the body turned to the side, keep the knee up to keep the person from kind of like rolling around, so that they, don't kind of reduces the likelihood of if they do vomit, then also choking on it. I just noticed, I don't know why I didn't notice when I put it together, but the image for their nasal naloxone is different. This picture specifically, I got them. I haven't seen that image before, but anyways, the same basic thing is true. So you can do like a sternum rub on someone's chest. I don't know if Renelle wants to touch base on that. It's awful. It hurts, but the whole point is to see if we can get them to wake up, right? We want to make sure that our biggest concern is just how we really minimizing how long they're going without oxygen. That's our our biggest concern. Okay. So here's where I like to come into play. So how do we have these meaningful conversations with those around us? I think just being open and direct. And so when I say open and direct, I mean, like, say you're talking to some young people, you know, right? Hey guys, we're going to talk about overdose prevention, right? Just say it what it is. You know, it's like, why are we talking about overdose? Well, because, you know, it's something that happens in a lot of communities. You know, addiction, overdose, drug use, it doesn't discriminate. It's everywhere. And as your whatever, it's important to me that you have the information that you need, or that, you know, I know that we have a clear understanding of what, you know, to do in those situations. And I think especially for adults, one of the things that can go a long way is if you don't know, look it up with the young person, or look it up with your family member, or look it up with your elder. Like, being open and direct. Because one of the things is if we don't feel comfortable having the conversation with the people, these kind of conversations with the people that we care about, then they'll find someone else to talk to, or they'll do the research themselves, and then we don't know. We don't know what they've been told or what they think they know. So just as simple as, like, you know, when I talk about like suicide prevention, right? I'll tell families, as awful and as challenging as it can feel to say and do, if you're concerned about somebody having thoughts of suicide, use that language. Hey, I am concerned about you. I worry that you're thinking about suicide based off of how you've been behaving lately. Use the words, because the more we can use the words that we're afraid to say, then the more that person hearing it knows that they can come to us. They can talk to us about these tough things. I think too often when it comes to things that are considered taboo, we use a lot of vague things. Well, I mean, you know how people are doing, well, I mean, you know how people are these days. That's really vague. You know, someone who maybe doesn't want to disappoint you or get in trouble or whatever, it becomes an easy out for them to play along with the conversation versus actually engaging in a meaningful conversation. Practice having, if you're doing like the prevention aspect, practice having, you know, as silly as it might seem, like mock or role play conversations. So, you know, what would you say if somebody offered you this? I don't know. Well, let's practice. Like, what could you say? And you can take it to the extremes or have fun with it, but also have some intention behind it. Like, no, I want you to practice what you can say. I mean, I even use this tool with, you know, young people I work with that are experiencing bullying at school. Well, this person said this to me. Okay, well, what did you say? Well, I didn't know what to say. Well, let's practice. What could you say? Or what could you do? So the more we can practice things, so the way our brain works is practicing something is still doing it. So if you're practicing how to say no, or you're practicing how to get help, or you're practicing how to, you know, have a tough conversation. In our brain, our mind still feels like it's already had that experience. So it takes some of the anxiety off of it. That's why a lot of times when I'm teaching like suicide prevention stuff, I'll have people come to my trainings, like, get familiar with saying the phrase, "Are you thinking about suicide?" Because if you're comfortable saying it in this setting, it'll never make it easy to say, but it makes it easier to say. Or if you're concerned about, you know, drug or alcohol use, practice saying, "Hey, are you doing heroin? Have you been exposed to fentanyl? Are you using meth? Are you using cocaine? Are you using alcohol?" Because a lot of times we'll say, "Are you doing drugs?" And for some reason, that seems to be, people are like, they'll say no. But if you kind of go down the list, if you say clearly and directly what you're afraid of, if you're, you know, even if you're right, it makes a conversation less stigmatizing. And like Renelle said too, like everyone's definition of drugs is different, right? I heard a phrase, actually been a while now. I was like, you gotta be kidding me. I don't know if anyone's heard the phrase California sober. That has different definitions depending on where you go as well. I thought when someone said they're California sober, it meant that they just smoked weed. And then someone told me, no, it means you can do a little bit of anything, but only in small doses. I'm like, well, a little bit of fentanyl is still deadly. Like, that's not, so clarifying the terms people are using as well. So if someone tells you like, no, I'm not doing whatever, and they use a street term or slang or a phrase that you don't know, ask them, wait, what did you just say? Like, what is that? When I had someone tell me, oh yeah, no, I'm good, I'm California sober, I'm like, wait, I don't know what that means. Can you break that down for me? Well, it means you can just do a little bit of anything as long as it's just a little bit. Can you break that down for me again? What do you mean by a little bit of anything? Because when I hear anything, I'm hearing da 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 da, right? A lot of times I'll hear people too, they'll say like, oh, well, if I ask them directly, then they'll just lie to me. You'll be surprised. You'd be surprised. Most individuals, I can't really think of a contradictory example off the top of my head, that need help, want help, but they're afraid to talk about it, or they're afraid to, they don't know who to involve or who to ask for help from. So I feel like a lot of these kind of conversations and these presentations, we're really trying to help reduce the stigma. And the only way we can reduce the stigma is by talking about it. And it kind of makes me a little sad how many times I'll have people that will like bring people to behavioral health, like relatives, to have some of these conversations. And I would really love to have that relative there too. Or what I have done in the past, and is actually, I love it. I'm more than happy to do it anytime, is I'll have people sometimes stop by and like, hey, I have a loved one I'm concerned about. I want to talk to them. However, I don't know what to say or do. Can I just like practice having the conversation with you? 100% yes. I would love to have the conversation with you. You can pretend to be the loved one you're concerned about, and I'll like walk you through how I would recommend having start that conversation, or vice versa. I can pretend to be the loved one and you can have the conversation. Role modeling and mock conversations, it feels awkward and silly. It is so helpful. It's so helpful. So tips for having difficult conversations: start with a goal in mind. Aim to understand. Okay. When I say aim to understand, one phrase I'll say, don't do that. Don't do that. Is I understand how you feel. No one knows how you feel. No one knows how. For any moms on the chat, you made a baby. You made a human being in your body, fed it from your body. And then that human being turned 12 and you were like, I don't understand you. So when I say aim to understand, is what I'll tell people is like, help me understand better. So we have a goal in mind. I really want to understand as best as I can. Clarify without minimizing. So what that means is like, don't minimize what they're going. Oh, you don't understand. My life is so hard. Oh, your life is hard. No. Just be with them in the moment. Be with them in the conversation. Choosing the right time and setting. Like, this is with a young person, like maybe don't do it when their girlfriend or boyfriend is over. Or like, maybe don't do it when that one data that's gonna blow things out of proportion is home. Like, finding the right time and setting is important. We don't want anyone to feel ambushed. We want this to be a productive conversation. Staying focused with a topic on hand. What I'll tell family members all the time is like, next time you go to a hotel, stock up on those little notepads that we like in the room. And if you're about ready to have a tough conversation with somebody, pull out your little notepad. One, just the act of like having a notepad gives you something to do to help calm your nerves during a tough conversation. 2, you can write down, like, why are we doing this anymore, right? What is our goal? What is the outcome we're trying to seek with this conversation? And then 3, when they start talking, write down what they say. You know, maybe, okay, so they're dealing with work, they're dealing with relationship stuff, they're dealing with whatever. Then when they start to deviate, right? I've done this with, you know, quite a few individuals where they're like, you know, we'll be 20 minutes into the conversation and they're like, and that's why I need to do math. I'm like, wait, no, pause. We're circle back. You said that job was really stressful. Why do you need this job? So you need to do math because you need to keep this job? That seems kind of silly. Like, I said, I'm not understanding. Like, can you help me understand it better? Now, this isn't me trying to say I want you to be all counselors. I'm not saying that at all, right? Bring us counselors involved when we need to be. But keep staying focused and topic at hand helps it feel like we're being like solution focused. And for the person who we're trying to talk to, it feels more validating, right? Or like I'll also tell people like, I love stories. I love learning through stories, but keep it short. We've all been in that setting where somebody was just going on for like 20 minutes and it got totally lost. The whole, why are we even having this conversation right now? Just got completely lost. I would say it's okay to express your thoughts and feelings, but keep it relevant to the moment. We're not trying to like guilt anybody or like shame anybody. So an example of this where I'd say like, you know, please try not to is like, you know, as your mother, it would just break my heart if I ever found out you were blah, blah, blah. Right. So then that kind of like, okay, so now I shouldn't really tell you if that happens. And when in doubt, ask for help, seek solutions. If you leave this presentation, you're like, wow, I actually have a lot of questions and I don't know if I know what I would do in that situation. It's okay. Like, come find one of us counselors. We're all over the place. We'd be happy to kind of walk through it. I will say I will be at the NACUSA Wellness Week next week, Tuesday and Wednesday. So if anyone's in NACUSA and wants to practice having tough conversations, I would be more than happy to role play as much as possible. I love it now. Okay. So we're almost out of time. Okay, so just really quick, overdose prevention. This is all about like the Narcan. Okay, let's go to the next slide. This is just specific to what Narcan is. The websites I provided just go into further detail if you want to actually understand like what Narcan does as a opioid inhibitor in the brain, then you can. Community resources, the one I wanted to get to, but we're out of time, which is fine, is a resource outside of HOTRUNC. They actually came to present to our staff in January, and their program is really cool. It's Next Distro, so Next Distribution, .org. They are one where if you click on the website or you look them up, even if you just look up nextdistro.org/Wisconsin, you'll see a bunch of stuff. But they have vending machines around the state. They have they'll mail Narcan kits. They do a lot of trainings, and they collaborate really closely with a lot of the tribes. The presentation I saw specifically was people, where was he out of? Bad River was doing, they were promoting it introducing it to us. So I thought that was really, really cool. And then I can't reiterate enough, like overdose. If there's your concern about overdose, just call 911. Just call 911. It seems like a hassle, but it's worth it. Okay. Okay, I do not know why that slide's there. That is not related to us at all. I am so sorry. I don't know why that's there. That should have been deleted from the template that I used. Okay, and then there we go. 9:46 or 1:46, I went over by 1 minute. Any questions or things I can help with? I love seeing the discussion on the side. I have to say, I've done these presentations before, and I don't get it when people are just kind of absorbing information, but the discussion I think is really fun. For now, Jamie, anything I missed, or anything you're hoping I can maybe elaborate a little bit more upon?
So I'm not seeing any outstanding questions in the chat right now, but I would agree. A good conversation today. And as soon as Rachel gives me the handouts, I will make sure everyone gets the handouts and the slides from today.
Do you want me to put the specific ones onto like, yeah, I know it, never mind. Answer your question. I will get you those handouts.
This is a good one. Curious, what do you say to someone who says that the vending machines, so like the public health vending machines that have harm reduction materials in them, are giving permission to people to use drugs or encouraging drug use?
I would say, do you think us having bowls of condoms out in the lobby is encouraging people to have sex, or do you think people are going to have sex regardless of whether or not we give them condoms? So I think the vending machines, especially when we're talking about like, the Narcan and prevention, and I've heard people say it too, I think you guys having like Narcan available all over the place is just, you're just giving people an excuse, an easy out in case they, they want to use drugs, whatever. And it's okay, but that's not reality. I think like the idea that there are some things I think that, tough love can be very helpful with, right? Like if my kid's in the kitchen with me and I can tell her 17 times I'm blue in the face not to touch the stove, it's hot. If she touches the stove, I'm not going to be the most empathetic person. Because they're like, dude, I told you not to touch it. It hurts, right? Yeah, well then don't do it anymore. That's a tough love moment, right? These aren't tough love moments. These are, people are going to do drugs regardless. If someone wants to do drugs or is already engaged in and kind of stuck in that addiction cycle, right? It's already going to happen. But why can't we make tools accessible to help reduce the likelihood of them not being able to choose differently tomorrow? Right? So like a lot of times when I'm having conversations with people that will kind of be kind of stubborn with this, if it is, I'll use like I said, like the safe sex example. Like they're gonna do it anyways. Would you rather them have a condom so that we can at least hopefully reduce like STD transmission or like unplanned pregnancies? It's, we're here to help people. And I think a lot of times when I see that kind of like stubbornness or that resistance is coming from a place of hurt. And I think hurt people have a tendency to hurt other people, sometimes a lot of times unintentionally. And when we're trying to heal our community, then it comes down to helping people. So I hope that helps. Maybe just some conversation ideas. How to start a difficult conversation with these young adults that are binge drinking and driving. They don't think they have a problem. I think I would love to see is just having just conversations with our young people. So what's leading to the binge drinking? And then find out what they say. Why are they, well, one, why are they drinking? If they're drinking, why are they binge drinking? If they're binge drinking, do they have a plan like we talked about earlier, right? That's why I think the toughest part of prevention is we can't go back in time and stop anything that's already happened, but we can try to prevent future occurrences. So going forward, really pushing for families to have these conversations of if you're in this situation, what can you do? If you're in this situation, what's an option to get out of it? And if they say, oh, I don't need, I'll be fine. I'll be fine. No, I don't care. Like, I want you, just like when you learned how to drive, I don't want you to tell me, I know, I get this. No, I want you to show me. Show me what you're going to do. Let's make a plan. And if everyone in the room is like, I don't know, cool, let's reach out to someone who does know. I don't know anyone who does know. Cool. Well, I guarantee there's 3 people right now, at least, that can provide some guidance, reach out to the community, resource we have, go to your local community center. We have counselors stationed at, pretty soon, I think we'll have someone covering Toma soon. We still have someone covering Toma. Kind of walk in and say, hey, I'm in this kind of tough situation and I'm trying to help my relative and I don't know what to say or do. I tell a lot of times when it comes to like addiction stuff is I always tell people addiction equals distraction. So binge drinking, although it doesn't, they might say, well, I'm not an alcoholic. I just drink on the weekends, or like, I just drink when I'm with my friends. Okay, but why are we drinking? It's addictive behavior, like using alcohol is like, an addictive behavior. It's still a distraction. So what are we trying to distract ourselves from? And then, so a lot of our young people, it's, like social anxiety. Well, that's what I'm hearing is, well, if you need to get drunk so you feel less socially awkward, are you even in a situation that you should be in to begin with? Because if you're around people who care about you and respect you, you wouldn't have that same level of social awkwardness. So that's a whole different conversation. Does that kind of help a little bit?
I think a little bit. I've tried to have the difficult conversation with my nephew. He just recently turned 20. He drinks a lot. He drives. He has dents along his vehicle. I mean, and to keep bringing it up, the same conversation and asking him why he drinks, and he says, I don't know, or it's not a problem, or gets upset that I'm even bringing it up. I don't know where to go from here. I mean, he's gotten, I don't know how many underages. He actually is at court today for a drunk driving, to see what that's going to come out of it. I just don't want this to continue on and it be something way worse than what it's already gotten to be.
So that can be something too, Jamie, if you want, like, me and you can find some time to like role play some stuff, but for the for everyone who's listening in, I think what I'd be kind of curious about is like coming at it from like, and it's kind of hard because you've been the one trying to help him see kind of like reason with it, is maybe shifting gears into kind of like a stupid curiosity role. Call it like, I'll tell my older people, like, just be stupidly curious. So with that, like, hey, so what are you doing this weekend? I don't know, probably same old. Why? What would you rather do if you didn't have to do the same old? Or like, if it's the drinking thing, like, I'm just kind of curious. I'm not mad, I'm not frustrated, I'm just curious. Like, when you drink, how do you feel? Like, what does it do for you? Right? Kind of like the same conversation we might have with somebody who's in a really unhealthy relationship, right? We're like, I'm just kind of curious, like, why are you with that person? Like, doesn't seem like you're that healthy and they don't really treat you very well. Like, well, I don't know. We have a lot of fun together when things are going well. Okay, cool. Well, I'm wondering what the alcohol does, what the alcohol is distracting from. And then as far as like the driving element, is that possibly coming from a place of like denial? I know a lot of our young men specifically, I call it Superman syndrome, where between like, I swear, like 16 to 30, they have this, it's somewhat biological, but there's just this like complex of like, nothing can hurt me. Like those things happen to other people. Other people get into car accidents. Other people get like these punitive consequences. It won't happen to me. So finding ways to like turn the conversation almost more into like an interview, like, hey, I'm working with, with my job, I'm trying to like understand this better. Can you help me understand it better? And what I find interesting is for a lot of people, the more they try to justify the behavior, the harder it becomes. Because deep down, they know it's not healthy. Deep down, they know like what they're doing isn't correct. And they can only try and justify it for so long. And that's why a lot of times they'll turn to this, you know what, this is why I don't want to talk to you. I'm not going to talk to you anymore. Jeez. And then they leave because they don't have an argument. So sometimes if we can turn it into like stupid curiosity, and if nothing else, that conversation's still in his head, even if he can't stick around to finish the conversation. And then like, keep having that conversation. That's a tough one. Yeah. I'm more than happy to spend some more time with you outside of the training if you'd like to. Yeah, I'm sorry, right now it's true. I was saying, like, usually around the time of the prefrontal cortex kicking in and like doing its wonderful thing, usually the Superman syndrome starts to wear off a little bit.
All right, I have a follow-up question. How bad has their drinking gotten, say, if at a young age they already can't control themselves when they're sleeping, like they're already losing control of their bladder and vomiting and things like that in their sleep? Is that more of a worrisome, like more acting sooner rather than later?
Acting sooner rather than later. That to me is already starting to imply alcohol dependency. And if we're doing alcohol dependency, then that's looking at a full medical detox, rehab. I would, one of the things I don't think we utilize enough with the nation, just because I think people just don't like the inconvenience of it. But MAT, we've had a lot of people who will go on Vivitrol for alcohol use to help with cravings. A lot of times they want to do, semi treatment, and treatment's wonderful. Okay, I'm not knocking it at all, but especially with alcohol use, medical detox, 100%. And if it's deemed that bad, the tricky thing is like he's 20, so he needs to be able to give consent to a degree, but families have been known to like chapter people where it becomes like a forced medical situation. But if you can give him a detox, if he's willing to participate in ideally a 45-day inpatient treatment, 30 days doesn't, statistically speaking, 30 days doesn't really do as much as we would like to see it do. 45 to 90 days is much better. That's why a lot of times we'll try and do like a 30-day inpatient stint, and then we'll try to get them into sober living for like a few months. People don't usually like that because they miss their friends and their family and want to come home. The concern is though, is you were home when this is all going on. So we want to make sure everyone's like really mentally ready to come home. And that's where I think like the MAT, medication assisted therapy in conjunction with outpatient therapy is really, really important. Just really trying to surround this person with as much information as they possibly can, as much resources as they can, so that when they do come home, the chances of relapse is less. Because to be honest, it's Wisconsin. There's more bars than people here. Like, I swear, it's awful. But I would, yes, no, what you just described without laying eyes on him or knowing the full scope, to me, implies we're looking at alcohol dependency already, in which case he should not cold turkey it. I think it'd be fun just to even have like open discussions in the future if we ever want to. I think knowledge is power. We don't get to have conversations like this very often.
It is 2 o'clock, so I will close this up. I thank you so much, Rachel, for having us today. We will just keep inviting you and hope that you keep saying yes and find time in your schedule for us.
You know, I have a hard time saying no to you, Renelle.
But thanks everyone who joined today, and we appreciate you spending part of your day learning with us. As a reminder, today's recording will be posted on the Department of Health website and Facebook page for anyone who would like to watch it again or who would like to share it with others. We hope you will join us for our next virtual education series on Wednesday, September 9th. We will be featuring exercise physiologist from Black River Falls, Kathleen Clements. You can use the same WebEx link that you used today for every session in the series. If you would like the recurring link added to your Outlook calendar, you can email Renelle or I, and we'll be happy to forward it on. Before you leave, we'd be greatly appreciative if you do our little feedback survey that Renelle put in the chat. You can also email us with any additional questions, suggestions for future topics. Amy, we did see your suggestion for later. And we hope everyone has an amazing Wednesday. Thank you so much, Rachel, for joining us again. Have a good day, everyone.